So first of all, to answer this question, I think the more important thing is doing a little bit of introduction of fertility and age. I always explain the patients that fertility is very dependent on the age of the patient. We know that we have a certain ovarian reserve that we are born with, and this ovarian reserve is going to decrease with age. But in terms of numbers, but also in terms of the quality of these eggs that we have. Okay, so actually, what we can test is the ovarian reserve in terms of numbers, but not the quality of the eggs that we have, and that's why we are always talking about age and fertility. That's the reason. So what we do know is that, for example, after the age of 35, 37, and 40, it's more difficult to achieve a pregnancy, to have a good outcome. We know that after 40, it's more tricky to become pregnant. There's a higher risk of having a miscarriage. And also, there are higher rates of having embryos with problems with the chromosomes. And all this is related with the quality of the eggs that goes related with age. Saying that, the second thing that I want to say is a good embryo in terms of morphology doesn't necessarily goes related with a good genetics of the embryo. Okay, so we can see a very beautiful embryo, but this is not going to tell us if the embryo is euploid embryo or not. Euploid means that the embryo has the correct number of chromosomes and the good disposition, okay, of them. So that is also a very important thing to know if when we talk about good embryos, we are talking about just having taken into consideration the morphology or also the genetics of the embryo, which is very important. Okay. And the third thing is, of course, so if we are transferring good quality embryos that have been tested, that we know that are euploid, so that have the maximum possibility of implanting and giving a pregnancy, when we are using euploid embryos, we know that the success rate is like 70% more or less. So we know that not all of them will implant. And this can be because of just statistics. We know that not all of them will implant. We would like to give 100%, but we know that it's not like that. Okay. And on the other hand, if we have several implantation failures, then we need to check if there's something else that is affecting it, okay? Because the first thing that we have to check is if the embryo is correct in terms of genetics, and also the parents that are giving the egg and the spermatozoid, also knowing if the karyotypes are correct, okay? But then in a second time, if this is confirmed and still it doesn't work, we have to rule out, for example, thrombophilia factor that is having for example, a predisposition of having blood clots and problems to become pregnant, repeated miscarriages. We have to study the uterus to make sure that everything is correct with a hysteroscopy, a biopsy. We can also study the endometrium and to see if there's a problem with the receptivity of this endometrium, or we can also test the microbiota, and also we can test some immunological things that could be responsible of this bad outcome.